We should be live. Oh, nope. We don't want to end yet. I almost ended the podcast too early. Those watching the live stream, you can hear us, but you can't see us. So stay tuned. We'll be live in just a few quick moments. We'll be live soon with Dr. Alicia Bazzano, Chief Health Officer with Special Olympics International. Will be coming up in just shortly. Remember, the audio podcast will be posted within the next day, as soon as I can get that posted. But I just want to remind you, so you can subscribe on specialchronicles.com to our newsletter, subscribe to the audio podcasts on wherever you listen to podcasts, and you can support this podcast by texting. You can grab your phone. Well, okay, people can't see me, so grab your phone and text GIVE to 833-953-2598. Text GIVE to 833-953-2598, or go to specialchronicles.com/give, and you can click the donate button. So we'll be live. And just quick thing, I want to see if Dr. Alicia, if you can hear this.
This is Special Chronicles.
I sure can.
Okay, yep. Cool. So we're going to go ahead and get started with the podcast episode in 3, 2, 1. Support for Special Chronicles comes from listeners like you. Please support this podcast at specialchronicles.com. I forgot to recode that. Hold on. That's the cool thing about this live stream is you guys get to see the behind the scenes. I forgot to press record. I was too excited for the conversation. So let's try that again. Support for Special Chronicles comes from listeners like you. Please support the podcast at specialchronicles.com/give. That's specialchronicles.com/give.
This is Special Chronicles, giving respect and a voice to people with special needs.
Podcasting since 2008. This is the show where we're broadcasting disability stories from an insider's perspective, and we are giving a voice to people with special needs. This is your weekly guide to find and joy, acceptance, and inclusion.
I shudder thinking how the world can be so cruel. I lend my voice to those who can't. It's time we try, it's time we care, it's time we stand. It starts with a voice.
I should unmute myself. Coming up on the Special Chronicles show, episode 381, we welcome Dr. Alicia Bazzano, Chief Health Officer at Special Olympics International, to talk about return to play protocol and important health guidelines for all Special Olympics programs. Tune in right now on specialchronicles.com, and welcome back to the fine groundbreaking show, on specialchronicles.com. My name is Daniel, founder of Special Chronicles and a Southern Striver International Global Messenger of Special Olympics. So excited. Please put your hands together as we welcome Dr. Alicia Bazzano, the first ever Chief Health Officer for our Special Olympics movement.
Hi.
Awesome. Good to. I'm glad we finally found the time in both of our busy schedules, doing this global pandemic to have you on the Special Chronicles show.
Thank you. Thank you so much for having me. And I'm very, very excited to talk to you, and especially to get to talk about returning to activities.
Yeah. So let's. This is I've been doing some preparation for time together, as you can see in the show notes. That, and so for a lot of our new a lot of our new listeners, why don't you introduce begin with having you introduce yourself to our listeners, tell us about your family, your professional background, and your connection to our Special Olympics movement, and in particular to our health programs.
Oh, thank you. I am so excited to be here. I've only been with Special Olympics International for just about a year, and it has been absolutely an incredible year. I am a pediatrician by training, and I worked with children and adults with intellectual and developmental disabilities as a doctor and in programs throughout the US and then internationally as well. And I started a community clinic for children and adults with intellectual and developmental disabilities. That's an inclusive health clinic.
Cool.
It's integrated physical and mental health in Los Angeles. I got involved with Special Olympics and I'm a parent actually too. I got involved with Special Olympics though. I was at the World Games in 2015 in Los Angeles, where my clinic was. And my kids were sitting in the stands at the Coliseum with everybody else. And we absolutely loved it and said, this is the way things need to be. The unified atmosphere, the happy attitudes, the courage and the strength of the athletes who were competing was so impressive that my kids couldn't tell the difference between Special Olympics athletes and other athletes who might not be Special Olympics athletes. And I said to myself, I want us all to work together, and that's where I want to be, is in this kind of a world. And so it took a while. I became a clinical director and volunteered at Healthy Athletes in Southern California. And when this position opened up, I was so excited to be able to lead the health work around the world for Special Olympics. And I have a lot that I know that we should be doing, and a lot that we can be doing, and a lot right now that we are doing during COVID.
Awesome. Yeah, I also was at the 2015 World Games. I wasn't competing, but I was producing a daily live to tape podcast during those games. And yeah, that was an amazing event. And what you just said of how your children had said that they couldn't tell the difference between the unified partners and the athletes in Special Olympics. When my mom, when we were sitting in the press booth at the fast forward to during the 50th anniversary and the Unified Cup finals here in Chicago, and my mom said the same thing that you and your children said, that like she couldn't tell the difference between the unified partners and the traditional. And I feel like, and I'm sure what we'll get into hopefully in this conversation on this episode, is that what has been happening for however long we've had the unified sports programs, where you can't tell the difference. Hopefully we can break down some more barriers when it comes to the health programs, and yes, doctors and health professionals might need to have more understanding, but also maybe they will see that they can't really tell the difference as well. Is that
Oh
true?
my goodness, exactly. Yes, that's all of what inclusive health is very much about. Everybody has unique needs, whether you've got an intellectual or developmental disability or whether you've got diabetes. Everyone has a unique need in medicine and healthcare. And our goal is to make sure that those needs are met and that people with intellectual disabilities get treated the same as everyone else. Awesome. And eventually, we really want to get to a place where there's no big difference in where there is right now in the number of health conditions and how severe the health conditions are for people with intellectual disabilities. When I do my job right and when we do our jobs right, as physicians and as health professionals, we'll get to a place where the people who have intellectual disabilities live just as long and happy and healthy lives as people who don't have intellectual disabilities.
Awesome. And a brief side note before we move back into like the main topic for the show. So today, but my sister, who is a few years younger than me, but so she just got married last May, but she is a doctor of physical therapy. So I actually, back when she was, her bed, well, I've only lived here for like where I am right now for the past 5 years. But when we moved from our house to this small apartment, her bedroom was actually right where I'm broadcasting from right now. So I surprised her one time and brought her on the show last minute. But she talked a lot about, it was like, last year of grad school, getting her doctorate. And she talked about working with those of us with intellectual disabilities in the physical therapy. But the same thing can, I think, be said for any health programs.
Yes, yeah, I think so. Is she part of the movement? Is she part of our Healthy Athlete Screening Program?
I don't think so. I'll have to ask her again. But I think when in college, I think she and some of her classmates did some work with our healthy athletes here in Illinois. So
very nice. And for your listeners and viewers, Healthy Athletes is our health screening program that we do. Generally, we do it at our events, and we've done over the past 20 years, more than 20 years, we've done 2 million screenings, health screenings in every part of the body, every specialty, like hearing and vision and dental and overall health, and all the way down to your feet with podiatry. So this is a fantastic program that we've just expanded, and it was the start of our health work, which has just blossomed so much that I am excited to get to talk to you about it. And even now, we are in such a transition time with COVID. We're still right out there trying to reduce and prevent any conditions that people with intellectual disabilities might be getting.
Awesome. And so now as we move back on, I think I want to say it started around the World Games in 2015 with partnering with the Bazzano Foundation.
Yeah.
And so with that, you, as I mentioned at the top of the program just 10 minutes ago, you're the first ever Chief Health Officer for our Special Olympics movement. So tell us about why this job was created for you as a Chief Health Officer, your day-to-day operations, the importance, the vital importance for this leadership role within our global movement at Special Olympics.
Oh, thank you. This is a very exciting time for Special Olympics to be able to really, really deeply get embedded in the health work. We know that to be a healthy, to be at your best as an athlete, you have to be healthy. And beyond that, as a movement, we absolutely need to represent the health of people with intellectual and developmental disabilities. Since 2012, actually, we've partnered with the Golisano Foundation, and our health work started with Healthy Athletes over 20 years ago, really just exploded with our partnership with the Golisano Foundation, into our healthy communities. So that's not just the health screenings and the follow-up that we do there and the training that we do there, but it's also all of the ongoing health work. So you've probably seen, especially during COVID, all of the fitness work that we do, including our fitness videos, our School of Strength, our Fit 5, all of that work is the ongoing health work we do. The nutrition, the physical activity, the healthy habits, the making sure that we are doing a lot of education on prevention, the working with families in our family health forums. And we really have a program that starts from the moment, we want to start from the moment you get that diagnosis all the way through your lifespan, to make sure that we are health partners all along the way. So from the youngest athlete and young athletes, making sure they are healthy all the way through the older athletes, and making sure that they have the proper supports that they need as well. So it's very much a long lifetime support program. And we have the ongoing health work, the screening work, the training of the health professionals that we're doing around the world. We've trained over 200,000 health professionals, both in healthy athletes and in universities. And then we're doing advocacy. You talked about our health messengers. We have over 2,000 athletes and families who are right out there, very much on the delivering the messages, advocating for health equity, meaning that people with intellectual disabilities have the same opportunities for health as people without intellectual disabilities. And we do that. And if you package all that together, that's a healthy community. And we're on our way to getting 100 healthy communities around the Special Olympics globally. So it's very, very exciting. This is the first time that we were able to put this all together and have someone who was a doctor, as well as in public health, as well as, I have to say, as you know, I'm a big, big fan of Special Olympics, and very, very much support the movement, support sports as a form of well-being, both your health and your physical well-being, as well as your social and emotional health and well-being there.
Yeah, I know, and we'll mention our good friend Hannah, fellow SSIGM and health messenger from Colorado. But when we were at World Games in Abu Dhabi last year, we actually did an Abu Dhabi Daily Show episode at the Strong Minds discipline, which I know not a lot of, I know we don't have it yet in Illinois, and I know not a lot of programs have it yet. But yeah, it's important. Yeah. I think that we added that discipline to what we offer in healthy athletes.
Absolutely. I'm so glad that we're working on social and emotional health and well-being in healthy athletes and beyond that. Even our global movement is looking towards considering both the physical well-being and how fit our movement is, how healthy they are physically, and how healthy they are emotionally. And we very much are looking for, that's all part of reducing isolation and feeling that sense of belonging. So we do this, we do give coping strategies, and we do screenings during Strong Minds. And we have a much larger program for emotional health and wellness, education, whether it's in the families with the family health forums, or some of the work that we do in different countries that work towards education on social emotional well-being, and even exercise itself. That is a very well-known treatment for depression. Yeah. So just getting out there and exercising is a wonderful coping skill for all of us.
Awesome. Yeah, I know my girlfriend Georgia, and I've got a picture of her above here. I've got some other pictures of her in the studio here too. But both of us actually met in the athlete leadership programs, and because we both swim. But quick, you mentioned the Fit 5 and School of Strength and some of these awesome programs that we have. We actually, when the Beck and Mouch, when the Global Pandemic Ready started here in the U.S., we actually launched in partnership with our health programs here in Illinois, but then also I also kind of got a request to do this from your team at the international level as well. But we have a health podcast mini series, 5 episodes with actually part 0. So actually, if you include part 0, it's actually more like six episodes. And people can go to specialchronicles.com/health let me put that up on the, not that one. You can go to specialchronicles.com/health. I think I spelled that right. So we will check that. Did I spell that right? Specialchronicles.com/health. People can go there. I'm getting from behind the scenes a thumbs up. So, and we walk through an introduction to COVID-19 and then fitness and
Very nice.
different things. So definitely recommend that to our listeners. So let's move on. And can you give us an overview of the Return to Play protocol? We'll put a link to this PDF as well as all the resources, all the new resources that I know that at Special Olympics had tweeted the beginning of this week. But
Yeah.
give us an overview of this Return Activities protocol.
Yeah, absolutely. So we did, there was a long development process where we really consulted health and sport authorities. We made sure that we were following the CDC guidance and the World Health Organization guidance and similar guidance. And we got a lot of input from athletes, from families, from members of the movement, from the programs themselves. Above all, we wanted to absolutely ensure that the health and safety of all the members of the movement were our top priority. We wanted to, at the same time, try to get as much participation as we could. And at the same time, just recognize that we're a sports organization, but we're beyond a typical sports organization because we are a movement that is by and for and with people with intellectual disabilities, so that our guidance was going to look different. It was based on the particulars of our sports, of our health, our leadership programs, our schools programs. We needed to take the risks into consideration there and really do different kinds of education. So what we came up with was phases. We have the red phase, which is everybody's in stay at home. And then the orange, yellow, green. And the orange is the first phase out. We have activities with less than 10 participants. The yellow is the next phase, and that's with less than or equal to 50 participants. And then finally, when we do get to out of the pandemic in terms of we've got vaccines or we've got no real reported cases, then we'll get to the green zone where we don't have size restrictions on this. So we developed that, and then we really thought about what each of these phases needed, and they really did need a lot of education beforehand of all the members of the movement. We have a code of conduct that everybody is expected to adhere to and understand. That's the do's and don'ts. Do stay 6 feet apart. Do social distance. Do keep your mask on when you're not doing exercise. Do wash your hands. Don't come to activities if you have symptoms. Don't come if you've had COVID or COVID exposure. So we really have been trying our best to make sure that everybody knows the do's and don'ts, that we're all educated before we get there, and that we can make the play on the field as safe as we possibly can, even if it's 10 people or less. So
Awesome.
putting signs out, making sure that you only use your own equipment and you're not sharing equipment or sharing water bottles, keeping that social distancing, keeping a close eye on who's there in case something does happen, monitoring everybody's symptoms, and then being able to trace if somebody does get COVID, sticking with the authorities, making sure we do everything that we need to for our authorities, and making sure that we have everybody, we're aware of who was there in case we would need to get in touch with them.
Awesome. And for the second time, I know that you have another call, so we'll have to continue this conversation with a part 2 in the coming weeks when we can get that scheduled. But there's a few.
I would love
Yeah, I want to, because we have a lot more important health guidelines to get to, but we'll have to continue that in part 2. I want to let everybody know that behind the scenes, I'm told that since 2012, we have partnered with the Bazzano Foundation, and I have been doing health work for over 20 years. And over 80% of healthcare professionals don't have the training to treat those with ID. And so I want to, before we get to some final thoughts for this part 1. If we could just play a quick 2-minute sponsor break, is that okay? And then we'll come back to wrap up for part 1.
That sounds wonderful.
Our guest is Dr. Alicia Bazzano. You are listening to the Special Chronicles show. We'll be right back after this short break. Don't pause. We'll be right back.
Hi, my name is Lisa Noble, and I'm a ComEd Energy Force Ambassador and an athlete with Special Olympics Illinois.
Hi, my name is Daniel Spakowski, and I also am a ComEd Energy Force Ambassador and founder of a company called Special Chronicles.
The ComEd Energy Force program is a program that hires people with disabilities to teach the public how to save energy and money.
It's the country's first energy efficiency program of its kind.
Saving energy is especially important while everyone is at home due to COVID-19. We're using more electricity than ever before. Just think about how many more times you are opening the refrigerator door these days.
And while the economy is stressed, it's more critical than ever to save money where we can. Following these tips can save energy and money in this time of COVID-19.
Wash your clothes in cold water and use the dryer sparingly.
Your dryer can take up to 7 times more energy than the washer.
Turn off and unplug any electrical devices or power strips you are not using.
Electrical devices can continue to zap power even when turned off if they're still plugged in. We call them vampire devices.
Use LED bulbs.
They use 25% less energy than incandescent bulbs and last up to 25 times longer, saving you lots of money over time.
Keep your refrigerator between 35 and 38 degrees.
And be sure to use Energy Star appliances.
And last but not least, check out ComEd.com/home savings for more tips and rebates.
Lisa and I would like to thank you for taking the time to listen to us today.
Remember, we are all in this together.
Stay healthy.
And stay safe.
Bye.
We are the ambassadors of an uprising.
Peaceful protesters.
In a rebellion against anyone
Who has a fear of difference.
Difference.
Our demands are
equality,
dignity, and the recognition of our shared humanity. We will not stop
or accept anything less.
Today, our world is
More divided than ever.
and coming together has never been more urgent.
The revolution
is inclusion.
Find out more at jointherevolution.org.
You are listening to the Special Chronicles show right here on specialchronicles.com. I want to remind you that, again, you can text GIVE to 833-953-2598. That's text GIVE to 833-953-2598. Go to specialchronicles.com, and we thank you for your generous support of our mission at Special Chronicles. And just toward in the we'll lift up that fourth wall. But Dr. Alicia, you said that your next call is at 6:30 Central.
Yes, it's 6:30 Eastern time. I have a call with the CDC. Actually, it's about COVID. So I've been talking to the CDC since January about COVID, and we've been really keeping in touch. And I will say that it's going to be a long haul. We're still looking at probably no very large events, at least through the end of this. We're looking through the end of the year. And so I think COVID is going to be with us for quite a while, as you've probably seen. And we need to do as much as we can to protect ourselves and to protect everyone in the movement, which is why we developed the Return to Activities protocol the way we have. And it's why, oh, fantastic. That is so good to see.
Yeah, it's a United branded mask, but yeah.
Very good. That's fantastic. We did a COVID survey with our athletes and actually found that about 80% of them are wearing masks. So we still have a good 20% to go to make sure that we're doing everything we should. But I will say that everything that I've seen has been very, very positive. And we have a lot of resources for those who are interested through the programs on our websites. We've very much been trying to do a lot with regard to prevention, to know what are those things that you can do to prevent COVID, and to know how to stay fit and healthy. You mentioned we've mentioned the fitness work a couple of times, especially the online fitness work when you have to stay at home. The mental health and emotional coping skills. We just finished with our mindfulness work and our strong minds work. It's ongoing. And then we've been working with athletes like Hannah, who you mentioned before, who's been doing a wonderful video on what to do if you are in the healthcare setting for COVID and how to cope, how to get what you need out of the healthcare setting, and how to advocate for yourself. And so I'd very much invite everybody to go to the website also to look at our COVID resources specifically around advocating for yourself. I would absolutely love to have a chance to come back and get to talk to you more. If it wasn't the CDC who I had a call with, I would be on for the rest of the show. Because it's been a great pleasure to talk to you.
Yeah, it's been a great joy talking to you. So before we let you go and get on the call with the CDC, that is very important. But just on behalf of my fellow over 5 million athletes from across the globe, thank you for the work that you're doing as our Chief Health Officer for the movement. And looking forward to having you on for part 2. But just to kind of wrap up this part 1 in a nice bow, you want to just share your final thoughts on your overall time here today on the Special Chronicles show and impact on our mainstream community and what inclusion means to you?
Oh, thank you so much. I just want to say thank you to everyone who has been watching and listening and who's been supporting our movement. If you ask me what inclusion means to me, it absolutely means that that people with intellectual disabilities are out front leading the movement so that the world can see that intellectual difference, whatever other kind of difference, it doesn't make a difference. And we all should be treated equally.
Absolutely. So thanks again, once again, our guest on the Special Chronicles show, episode 381, has been Dr. Alicia Bazzano, Chief Health Officer with Special Olympics. I know a lot of you listening have been putting in your questions in the comments, like Hannah that we mentioned. And also, Renee is another SSI GM and health messenger as well from Hawaii. But I know Hannah and a bunch of other listeners have been putting the questions in the comments. We saw your questions, including questions from behind the scenes as well, and we will answer your questions in part 2. So I will compile those questions, and we will. Is that okay, Dr.
Absolutely, I'm very excited to answer and to come back. So thank you so much for having me, and everybody who's out there who's listening. Thank you, and be healthy and safe. And
until then, remember to show compassion. Show unconditional love, stay safe, stay healthy, and we'll see you next week. Until then, until next week, remember, choose to include.
Special Chronicles, giving respect and a voice to people with special needs.
There you go. I'm going to stop the audio, and I'm just going to stop the video for our viewers.